Imagine this. It's early morning. You're making coffee and your dog trots over for their usual good morning nuzzle. You reach down to pet that familiar wet black nose. And something feels off. Maybe it's dry. Maybe it looks a little lighter than usual. Maybe there's a small crust you've never noticed before. You freeze for a second and your brain starts spinning. Is this normal? Is this something serious? Should I be worried right now? You know exactly how unsettling that moment is? You start Googling at 11 at night, scrolling through forums, comparing photos of other dogs' noses to yours, and somehow ending up more confused than when you started. Some sites say it's nothing. Some sites say it could be cancer. You close 40 tabs and you're still no closer to an answer. And what's worse? That little voice in the back of your head that says, "What if I missed something important?" That worry doesn't go away. It just sits there, quietly, every time you glance at your dog's face. But what if I told you that your dog's nose is actually one of the most honest messengers on their entire body? It changes before almost anything else does. Long before your dog acts sick, their nose can already be trying to tell you something. What if I told you that in the next 15 minutes you're going to know exactly which nose changes are completely harmless? And which ones mean you should call your vet today, not next week? Hi everyone, I'm Dr. Marcus, your neighborhood veterinarian, and welcome back to the channel. If you're new here, I dedicate this entire channel to helping you become the best pet parent you can possibly be, using simple, vet-approved knowledge you can actually use at home. No fear-mongering, no guessing games, just clear information straight from clinical experience. You are not a bad pet parent for not knowing this already. Nobody hands you a manual when you bring your dog home. The fact that you are sitting here right now watching this video already proves that you care deeply about getting this right. That matters more than you know. I actually posted a video a few weeks back on reading your dog's body language for hidden stress signals, which I'll link at the end if you want to go deeper after this one. So today we are doing a complete masterclass on your dog's nose. Grab a notebook, because I am about to walk you through 5 specific nose changes every owner needs to recognize, what causes each one, what you can safely do at home, and exactly when a change means call the vet now instead of keep an eye on it. Let's get into it. Chapter 1 is what I call the fading nose. This is the change that panics people the most, and honestly, most of the time it shouldn't. Here's the problem. Your dog's nose, which used to be solid black, starts turning pink or develops light patches. It's almost like the pigment is draining out of it. Here's the science, and stay with me here because this one surprises a lot of people. This is often not a disease at all. It's a completely normal condition vets call snow nose, medically known as seasonal nasal hypopigmentation. In colder months, an enzyme involved in producing melanin, the pigment that makes the nose black, becomes less active in some dogs, especially breeds like Labradors, Siberian Huskies, and Bernese Mountain Dogs. The nose lightens in winter and often darkens right back up by summer. It's cosmetic. It's harmless. It's basically your dog's version of a seasonal tan line, just in reverse. But here's what's truly fascinating, and also the part you need to pay attention to. It's not every fading nose is snow nose. If the color change happens suddenly, is accompanied by sores, scabbing, or swelling, or if it happens in a dog under 2 years old outside of winter, that can point toward an autoimmune condition called discoid lupus erythematosus, or a more serious one called uveitis syndrome, which can also affect the eyes. So here's the quick warning. If the color change comes with crusting, bleeding, or eye redness, don't wait it out. That combination needs a vet visit within the week, not a let's see what happens approach. Chapter 2 is the cracked leather nose. The problem here is simple. Your dog's nose, instead of being smooth and slightly moist, looks dry, rough, and starts to crack like old leather, sometimes even flaking off in little pieces. The science behind this is actually pretty straightforward. Your dog's nose has no sweat glands and needs the natural mucus and oils on its surface, plus a decent amount of licking to stay moist. When that balance breaks down, from dry indoor heating in winter, sun exposure, dehydration, or a condition vets call nasal hyperkeratosis, the surface layer simply thickens and dries out. Certain breeds are especially prone to this, particularly bulldogs, boxers, pugs, and cocker spaniels, because of their nose shape and skin type. Here's the remedy, and this one is genuinely underused. Instead of reaching straight for coconut oil like most guides tell you to, Try a pet-safe nose balm containing sea butter and vitamin E, applied in a thin layer once a day for about 10 to 14 days. Shea butter penetrates the cracked keratin layer more effectively than oil alone and won't leave your dog's nose greasy enough that they lick off every last bit within a minute. Gently massage a pea-sized amount into the nose leather. Let it sit for a minute, and you're done. If you don't have a balm on hand, a tiny dab of plain unscented coconut oil works as a backup. Just know it's less effective long-term. Now, here's a quick warning. If the cracking comes with open sores, bleeding, or a loss of the raised, pebbly texture on the nose surface, that's not simple dryness anymore. That can indicate a more serious skin condition, or, in older dogs, even nasal cancer. If home moisturizing doesn't improve things within 2 weeks, please have your vet take a look. Chapter 3 is the one I consider genuinely urgent, so stick with me here because this one is important. I call it the one-sided runny nose. The problem is discharge coming from just one nostril, not both. Whether it's clear, yellow, green, or blood-tinged. Let me guess. You're probably thinking a runny nose is basically a dog cold and it'll clear up on its own. Here's what's truly fascinating about this one, though. Dogs almost never get colds the way humans do, and when discharge is limited to just one nostril, it strongly suggests something localized is going on in that specific nasal passage, not a general infection. The most common cause, especially in dogs who love sniffing around outside, is a foreign object like a grass awn or a small stick lodged up there. Other causes include a tooth root infection pushing up into the sinus, a fungal infection like aspergillosis, or, in older dogs, a nasal tumor. So what can you safely do at home? Honestly, not much. And that's the point I want you to walk away with. This is one of those 5 changes where I want you to skip the home remedy entirely and go straight to Chapter 8, because one-sided discharge, especially if it's thick, bloody, or foul-smelling, needs imaging and a proper nasal exam that only a vet can do. Here's the warning, and I promise you. This is the one detail that matters most in this entire video. Any nosebleed. Even a single drop from one nostril that isn't explained by an obvious injury like running into a branch deserves a same-week vet visit. It sounds dramatic, but blood clotting disorders, tick-borne diseases like Ehrlichia and nasal tumors can all show up this exact way, and catching them early changes the outcome completely. Chapter 4 is my personal favorite because it's the one people misread most often. I call it the bumpy bridge. The problem is a swelling lump or raised area on the bridge of the nose, sometimes with the nostril pushed slightly out of shape. Here's the science. The nasal bridge sits right over the sinuses and the roots of the upper teeth. A swelling here can come from something as minor as an insect bite or a small scrape from rough play, all the way up to a dental abscess pushing outward, or, less commonly, a slow-growing nasal tumor. What's truly fascinating is how much the timeline tells you. A bump that appears suddenly after outdoor play and shrinks within 48 hours is almost always a bite or minor trauma. A bump that grows slowly over 2 to 3 weeks and doesn't shrink is a completely different story. At home, for a mild recent swelling with no other symptoms, you can apply a cool compress. It's just a clean cloth wrapped around a few ice cubes for about 10 minutes. 2 to 3 times a day for the first day or two to reduce inflammation. That's it. It's no creams, no home injections, nothing invasive. Here's the warning. If the swelling doesn't shrink within 48 to 72 hours, if your dog seems painful when you touch the area, or if you notice sneezing, nosebleeds, or facial asymmetry alongside it, please stop the wait-and-see approach and book a vet visit. Dental infections in particular can look small on the outside while causing real damage underneath. Chapter 5 is the textured nose, and this is the one that's easiest to miss because it happens slowly. The problem is the surface of your dog's nose, normally covered in tiny bumps and grooves, starts looking smooth, shiny, or unusually thickened. The science here ties back to something called hyperkeratosis again, but the chronic kind, which builds up gradually rather than appearing suddenly. About 80% of cases I see in older dogs come down to one of 2 things: age-related changes in skin turnover, or less commonly, a condition called zinc-responsive dermatosis, where a mild zinc deficiency changes how the skin renews itself, more common in huskies, malamutes, and other northern breeds. The remedy, if your vet has ruled out anything serious, can be as simple as adjusting for a possible zinc gap alongside gentle nose exfoliation, using a very soft, damp washcloth to lightly wipe the nose once daily, which helps shed built-up keratin naturally. Never use a scrub, pumice, or anything abrasive. The nose skin is far more delicate than it looks. Here's the warning. Because this change is gradual, it's the one most owners write off as just getting old. But sudden texture changes in a nose that used to look completely normal are worth a quick vet check, especially in breeds prone to zinc-responsive dermatosis, since a simple supplement, prescribed at the right dose by your vet, can resolve it. Please listen closely, because this is a massive veterinary warning that applies to everything we just covered. None of these 5 signs on their own tell you definitively what's going on. Your dog's nose can look almost identical whether the cause is completely harmless or genuinely serious. The single biggest mistake I see pet parents make is combining symptoms in their head and assuming the worst, or combining them and assuming the best without ever actually checking. If you notice any nose change alongside decreased appetite, lethargy, facial swelling, or bleeding that doesn't stop within a few minutes, that combination means you call your vet immediately, not tomorrow, not after the weekend. Here is the golden rule for actually managing all of this without losing your mind over it. You do not need to examine your dog's nose like a detective every single day. Daily, all you're doing is a 10-second glance during your normal petting routine, just noticing color, moisture, and texture as you say good morning. 2 to 3 times a week, take 30 extra seconds to gently touch the nose, bridge, and nostrils, checking for warmth, tenderness, or new bumps. As needed, whenever something looks different, use the cool compress or gentle moisturizing techniques we covered and start a 2-week mental timer. If it hasn't resolved by then, or if it's paired with any of the warning signs from today, that's your cue to call the vet. The whole process should take you no more than 1 minute a day. Worrying about your dog's health is one of the hardest parts of being a pet parent. It's a quiet kind of stress that doesn't really go away because you love a creature who can't just tell you what's wrong. But by choosing to educate yourself, by choosing to take just 1 minute out of your day to actually look, instead of just glancing past, you are proving how much you truly love your dog, and that makes you an incredible pet parent. If this video gave you a little more peace of mind today, please hit that like button. It genuinely helps more pet parents find this information when they need it most. Subscribe and hit the bell so you never miss our weekly deep dives. And please leave a comment telling me, has your dog's nose ever changed in a way that worried you, and what ended up being the cause? I read every single one. Give your sweet, beautiful dog a gentle boop on the nose for Dr. Marcus tonight. I'll see you in the next one.